Good evening, everyone. Welcome to Health Matters Live, where we tackle critical medical topics that affect our communities. Tonight, we're diving into vasculitis, a complex yet important health condition that many may not fully understand. But before we begin, let's dive into our facts segment. I wanted to tell my co-star David tonight that despite advancements in agriculture and food production, hunger and malnutrition remain significant issues. The United Nations estimates that over 700 million people worldwide face chronic hunger, while obesity rates simultaneously surge in many developed nations. What do you think about that, David?
Well, that sounds interesting,
Mm-hmm.
It sounds interesting.
Yeah, it's unfortunate that despite many millions that we have here in the US, hunger still persists.
Yeah.
Now we can get into our topic here, vasculitis. I will go to David to talk more about that.
Yeah, thank you very much. Vasculitis refers to inflammation of the blood vessels, which can lead to changes in the wall. It thickening, weakening, narrowing, or scarring the blood vessels. So these changes disrupt blood flow, potentially damaging organs and tissue throughout the body. It's a serious condition with the potential life-altering impacts.
Thank you, David. Vasculitis can present with a wide range of symptoms, depending on the type and the severity. Clinical manifestations include fatigue, fever, weight loss, and more localized symptoms like skin rashes, muscle pain, and even nerve dysfunction.
And let's not forget about the significant systemic impacts. Organs like the kidney, heart, lungs, and brain are particularly at risk when blood vessels in those areas become compromised. For example, vasculitis affecting the kidney can lead to organ failure, while damage to the brain can also lead to a stroke.
Thank you, David. To better understand how vasculitis affects patients and how it's managed, we've invited a special guest, Dr. Chioma Asuoha, a leading rheumatologist specializing in autoimmune diseases. Welcome, Dr. Chioma. But before we go to Dr. Chioma, we're going to have a quick commercial break. Hi, can I ask you a couple of questions?
Sure.
I just wanted to ask you, do you have a water bottle that you use?
I do, but my water's always hot and it's just not as cool as all these other water bottles everyone has.
Dang, so do you even use your water bottle, really?
Not really.
How many times have you seen a Stanley?
Those cool flask ones?
Mm-hmm.
Everyone has them, except for me.
Well, let me tell you why you should get a Stanley.
Okay.
Well, your friends have them. You need one too. Not only that, it keeps your water cool so that it's not hot.
No more hot water?
No more! Are you convinced to get a Stanley?
Yeah.
I will give you one right now.
Oh my gosh.
Yes.
Guess what? I got you one too!
Oh my god! Thank you so much!
No more hot water!
No more hot water. Wait, doctor. Doctor.
What a long day at the hospital.
Dr. Chioma, please wait up for me.
I'm on my lunch break. I typically don't talk to, family members while on my lunch break.
I'm not a family member, doctor. Life matters. And health matters live.
Okay.
Sorry, but we are here to ask you a couple of questions of vasculitis and how the head-to-toe assessment, what the head-to-toe assessment for vasculitis is. Basically.
Well, for the cause, I answer your questions, but
All right, thank
I'm on my
you.
lunch break, so.
Okay, I'm sorry.
Quick.
We can make it quick.
All right.
All right.
Hello, everyone. I'm Dr. Chioma Asuoha. Welcome to my hospital. Sometimes I call me when I was outside and on my lunch break. I'm always working. I did have my journal with me because even when I'm on break, I'm still going through my client files because I'm not the top doctor for nothing. But anyways, I am a rheumatologist specializing in autoimmune diseases. That's why I'm talking about vasculitis today. And let me show you a little tour. Just look around. This is where I'm at. I have 4 patients today. And I do have some press here asking me questions about different diseases. Hey, how are you, David?
Good. How are you doing?
I'm good.
It sounds like
I'm kind of in a rush. Do you have a few questions for me?
yeah.
All right, let's walk and talk.
All right. Um, Dr. Sharma, could you explain what healthcare provider focus on during a head-to-toe assessment of a patient with vasculitis?
Well, absolutely. On a patient with vasculitis, a head-to-toe assessment is critical. You want to make sure you're assessing every single bodily system, starting from the skin. When you're looking at their skin, you're looking for these little red rashes, as well as ulcers and any other erosions that appear on the skin. The skin is the key indicator, and that's how you'll know and be able to differentiate it from other diseases. These are key indicators, and then we check for joint pain, swelling, redness, all signs of inflammation.
Thank you.
We also assess the respiratory system for shortness of breath, chest pain, coughing, all those things that could show that something's wrong in the lungs. And then we check the heart sounds, murmurs, which is always a problem, and then any other abnormalities such as protrusions or irregular heartbeat. Renal dysfunction is also a priority. Neurological systems such as tingling, numbness are also key indicators because that shows nerve damage.
Thank you very much. That sounds like a thorough evaluation, and that is very vital. Can you tell us about treatment strategies?
Sure. Treatment depends on the patient, as any other disease, but for vasculitis, the treatment depends on how severe the condition is, meaning how long the patient has possibly gone without it being diagnosed, or just the type of vasculitis they have. In mild cases, they can usually use corticosteroids to reduce the inflammation, while in other serious cases, such as cases that are now immunosuppressive, they will need to use rituximab and cyclophosphamide. Supportive care, as any other disease, is used to manage the symptoms and prevent any further complications.
Thank you very much. Before we wrap up, what would you say is the most important message for our viewers?
Well, David, vasculitis is a life-threatening disease, as you know, but early diagnosis and preventative care is important, as any other disease. We can improve outcomes and potentially save lives. If you experience persistent symptoms like a fever, fatigue, inflammation, skin rashes, or pain, make sure you seek medical help.
Thank you so much. That was very insightful, Dr. Sheila.
Of course, I have to get back to my patients now, but thank you for your time.
Thank you.
And we're back, guys. Thank you, Dr. Chioma, for your throughout explanation about vasculitis and the head-to-toe assessments that are needed for that. We really learned a lot. We're just going to summarize what we talked about today, and I'll have my co-star, David.
Yeah, thank you so very much.
Sorry for that. We were lagging a little bit, but what did you say, David?
Yeah, so thank you so very much. We've learned so much. I mean, personally, I've learned so much from having a discussion with Dr. Shioma. I mean, she was able to educate us about the vasculitis condition. That it's an inflammation of the blood vessels, and it can lead to changes in the blood vessels, including the artery and the veins. Also, it can present in a wide range of symptoms depending on the type of severity, since we have different type of vasculitis. So that was very, very helpful to know.
All right, thank you so much, David, for talking about what you learned. Adding on to that, I also learned that vasculitis, you can not only do assessment of the blood vessels, but you also have to do assessment of the organs because that affects many different organs. I really enjoyed our talk with Dr. Chioma, but that is all we have for you tonight on Health Matters Live, guys. Stay informed, stay healthy, and we'll see you next time. All right. Bye, David.
Bye. Thank you.
Hello, everyone. I'm Dr. Chioma. I'm here with two medical students shadowing me, and today I was teaching them and showing them patients that have been diagnosed with vasculitis, and today I'm just basically going to quiz them and see if they're ready to move on to the next course. Are you guys ready? All right, first question. Name 3 traits describing the population that is most affected by Takayasu arteriitis.
I know that question. I know. Can I
All right,
answer?
Sundays, go ahead.
Okay, I think it's young women. Sorry, no, young people that are like 15 to whatever years old. And then I think it's also women mostly. And finally, it is. Hold on, I know this. Asian people.
The correct answer is young patients, female patients, and Asian patients.
Yay, I got it right.
All right, final question, class. What organ is spared in polyarteritis nodosa? David, Sandus, someone to answer the question?
Yeah,
Go ahead, David.
the lungs.
The lungs? All right, for the final question, the answer is the lungs. Why the lungs? Because in this form of vasculitis, it basically affects the vessels, the skin, and the kidneys in the GI tract, but it spares the lungs. And this is because it's associated with Hep B, and it uses immune cells to attack the endothelium, which is the skin, and it confuses Hep B, and this leads to necrosis and fibrosis. So it leaves the lungs alone, luckily. All right, that sums up our study session. Thanks for studying with me, and thank you to my 2 medical students that are shadowing me. Does anyone have any questions for me? Do you guys have any questions for me?
I don't have any.
No.
All right, sounds good. Well, my 2 students don't have questions for me, but I do have some questions for them. David, I have a few questions for you. First question I have for you, can you tell me the key indicators of vasculitis?
Fever, fatigue, weight loss, night sweats.
Yep, good job. Someone was paying attention. I'll send this.
Hi.
So, I have a question for you.
Okay.
In a patient with vasculitis, like the ones we were seeing today, what would you expect their skin to look like?
I would expect some skin discoloration, rashes, ulcers, and bumps under the skin.
Good job. Someone was paying attention. All right, class, final question. This last question will indicate if you move on to your next course set. You ready? All right. So, in a patient, like my patients that you guys were following me on today,
Yeah.
once we do a head-to-toe assessment, we're looking for neurological indicators, correct? What are 3 neurological indicators that we would see in a patient with vasculitis?
Weakness in limbs.
Yep,
Some numbness.
yep. One more.
And stroke-like symptoms.
Yep.
Oh my God! Yes, we're moving on to the next semester of med school.
That's right. Hopefully we